Hello everyone, I'm Charlotte Moore and welcome to today's Facebook Live with GBMC. Today we're talking patient safety with registered nurses Eve and Coretta. This is everything from patient safety issues to issues facing our nation's hospitals, so important, to how to be more informed as a patient. Remember, you can ask us your questions, just leave us a comment below. Welcome ladies, how are you?
Hi, thanks for having us.
Yes, so tell us what you do at GBMC, both of you guys.
Me first.
Yeah.
So I work as the manager of patient safety and accreditation. So I work within our quality and safety department, overseeing all things quality within the hospital.
Nice. And how about you?
Great. I'm the director for quality and patient safety for our physician practices at GBMC. So our primary care and multi-specialty practices both on and off campus.
I love it. So let's get into detail. Talk to us about patient safety and why it is so important.
Oh, it's so important for patients to be informed about their care, to know how to take care of themselves when they access healthcare, the healthcare system, and part of that is advising patients about their safety advocates and advocating for themselves.
Absolutely. So what are some safety issues that you feel like are facing our nation's hospitals right now?
So one big thing that hospitals, especially us at GBMC, are looking at are hospital-acquired infections. We want to reduce those rates and really bring numbers down. We want zero events. We want to see never events never happen. So that's really important for us.
Absolutely. And GBMC, you have wonderful safety measures that you guys take every single time. Let's get into that, Eve.
So we're looking at hospital-acquired infections. We're looking at hand washing for our nursing and our physician staff. We strive to be a high reliable organization.
Yeah.
And what that means is in healthcare, much like in nuclear power or aerospace or even the airline industry, we're striving to always have standard work. What happens, it should happen, we expect it to happen, and it happens every time. And there are different elements for that that is embedded within our culture. All of our staff and our physicians, they really pride themselves in looking at our organization. They should be aware of what's happening and what should happen at an expected time. They are not super excited about just seeing the standard explanation or a simple explanation for an event.
Gotcha.
They want to take that deeper dive. They have a preoccupation with failure, right? They ask questions.
Nice.
They look at what could happen and they try to prevent it before it could happen to a patient and cause harm.
Right. Gotcha. And another important thing with high reliability organizations is really having those standard workflows. So it's really hard to do the wrong thing. So by having those standard work processes in place, it's kind of like a checklist. You go down and you make sure you're doing the right thing every single time. So that makes it easier for our staff to do the right thing for every single patient.
Nice. So what steps are taken to actually prevent infection?
Hand washing. Hand washing is
Back
key.
to basics, right?
Back to the basics, absolutely. And hand washing could be either soap and water or hand gel, and it's before and after patient contact.
And I just, you see it all the time sometimes when you go to a public restroom that people don't wash their hands, and that just leads to so many other things. So you've heard it first from these ladies, wash your hands. Right. I'm telling you, it's the simple things that we should be doing.
It is.
Anything else?
Well, one thing for the hospital, so with flu seasons or when you're sick, I know we want to go visit our family members, our loved ones, or our friends, but if you're sick, don't come to the hospital.
Yes.
So love them by staying away from them and help them to stay well and get well.
Absolutely. And in a physician practice, if you are ill, and of course you might be coming to see your doctor, but just to know there are also well patients there for a well patient appointment. So you may be asked to wear a mask during your visit so we can stop the spread of germs.
Absolutely. So let's talk about the importance of technology and using those tools in order to help patients.
Having an electronic medical record has been such a blessing in the medical field. It is something that GBMC has really invested in, to have one chart, one record for our patient throughout the entire health system. There are barriers with that when you try to personalize the connection with a patient, And our technology is a tool.
Absolutely.
But, you know, I think the expectation for both the provider and the patient is the one-to-one contact.
Yeah.
And then just communicating, okay, wait just a moment while I document that in real time.
Right.
You know, so it's not a barrier in between the conversation.
Absolutely. And having that one-on-one personal connection, it takes the experience to a whole different level.
Absolutely.
Don't you agree?
Absolutely. And it's important. So like Eve said, if you're really not feeling that connection with your provider, ask them. Don't be afraid to question. Ask your provider, can you look at me? Or I have this question, or you're not getting the answers that you need to be informed, to make sure you speak up and ask those questions so that you're present in the conversation with your provider.
So how do you help, you know, patients to be more informed?
We do a lot between the hospital and the provider offices. So one thing that I just love about GBMC, so we've initiated lean practices into GBMC's everyday life.
Nice.
So,
what's that?
Well, part of that, one element of it that we've implemented is called Lean Daily Management, LDM. And Eve can talk a lot more about that. She has a lot more experience with it than I do. But I'm just so impressed with, like from the board of directors, our executives, right down to frontline staff, our leaders, our executives, they do daily rounding to key areas within the hospital every single day. You'll see them out on our units. So they're talking with frontline staff, they're looking at performance measures that units feel are very important to improving their processes. So the great thing about this, they call it an LDM board, a Lean Daily Management Board, with these performance measures and elements where they've kind of seen and identified areas for improvement. So you can see where staff have made improvements to that practice, and it's visible, these boards are visible on the units, so even the public can see, family members and patients. So we're very transparent about our processes and what we do.
I love it. And how can a patient be involved in the prevention of medical errors?
The biggest thing you can do is identify yourself, your name, your date of birth at every interaction, because a lot of patients are seen every day, and there could be names that sound alike or look alike, and you want to make sure your provider has the right person both on the computer screen and in their presence. And with doing that, sometimes patients get frustrated if frequently they're asked all day, every day, tell me your name and date of birth, but it is vital.
So, you know, moving with that, what are some questions that we should actually ask our doctor? You know, doctors are always asking us questions, but let's reverse that.
Yeah, so more than even asking your provider is to be prepared. So when you go to visit your, either the hospital for, you know, a scheduled visit or a surgery or procedure, or an outpatient provider, your primary care provider, come prepared with a list of your medications. So a very current list of not only the medications, but the dosages when you take them during the day. A current list of allergies is very helpful, because sometimes when you're sitting there talking with your provider, it's hard to remember what all of those are. Another important thing that patients can do to be informed or to stay safe is when you go to visit your provider, to bring an advocate with you, or a friend or a family member that can help listen to the information and then help you ask more better questions to be more informed about the care you're receiving.
Absolutely. Documentation equals conversation. That's one of my favorite things as well. And just in everything in life, because if you, you know, if you're more aware, more knowledge can be available. Don't you agree?
Absolutely. Knowledge is power.
Knowledge is power. Speaking of power, what would you think is one of the most rewarding parts of your job?
You know, I love when I can help staff. You know, our staff call both of us every day. You know, if there's a difficult situation, they need to have backup, and they need to know they have support from the organization, and that's what we can do and to help support them.
Yeah, and I think also having, so we're not in the weeds of doing the bedside care anymore, so it's really bringing in outside eyes to look at your process, so you can really look at things from a different vantage point and really help look at the process and identify areas of improvement, or just to help staff find more joy in their work for those standard workflows.
Absolutely.
That's helpful.
And you guys actually display patients, you know, safety measures online, very transparent. I love that. It speaks volumes.
Yeah, and again, an informed patient, that's what we want. That's
Yeah.
how we all stay safe. So keeping, like again, the LDM boards, the daily management boards that we do, visible for the public, for our patients, for our visitors that they can see, and then on the website. Even there's Hospital Compare, there's other government agencies that post.
Absolutely. We encourage patients to look at those public sites. CMS,
Yeah.
the Joint Commission, the Leapfrog Group. You know, right now GBMC has a letter grade of A, which is the highest letter grade for our quality and safety measures, and that's all public knowledge.
Nice. So let's talk about safety culture. What exactly is that?
That is where it is embedded in everything we do with every employee that patient safety is at the forefront. It's a little different than what is called a safety climate. A safety climate is just a little spot check. Are you hot or cold today? You know, but the culture is really that embedded throughout the whole organization and process. It's a focus on looking for prevention. You know, how can we prevent something from happening? And if something does happen, that we want to report it because we don't want that to happen to somebody else. You know, part of the joy that we have in our work is evaluating if an event does happen, how can we prevent this from happening again? And what systems can we put into place to see, you know, is this trending in other areas or is this just a one-off?
Right. And the other great thing about the reporting, so with our staff, part of our culture is to embed on our staff to have this questioning attitude.
Yeah.
So people would think, oh, they're reporting these events and that's a bad thing. But I view that as a great thing because they're not just reporting events, but they're reporting processes that this may not be a safe process. And we really want to look at this. So when I get these patient safety events, they're not just events, but it's our staff looking at the process that we can make improvements before they ever cause harm to a patient, which I love to get those reports.
Wow. So any examples of how these procedures, you know, really helped?
Sure. I want to just highlight too with what Karenna had said. It's the near misses that are the most important things. So
Absolutely.
if you think of the iceberg and how an iceberg, just the tip of it is above the surface of the water, that might be an event that has happened. But under the surface that's wide and low could be near miss events where they're just a potential for happening. It just maybe hasn't happened yet, thankfully.
Yeah.
And so if when staff identify a near miss event, that's the biggest reward.
I agree. Now, for those who don't know, let's talk about lean daily management.
Certainly. So it's a disciplined daily process that all of our staff and physicians participate in. It is where they are finding the pebble in their shoe, so to speak. It is the issue that they can work through it during their day, but it really bugs them. And what can they do to solve that problem, make their work better, not only for themselves, but obviously for their patients as the end result. So it could be an example like on the outpatient area. It might be looking at our MyChart, our patient portal. Like how many patients are signed up for MyChart? Because the more that are signed up, the more that will use it. And that's going to be better communication for patients and providers. So they track and measure. How many people did we sign up today? We have a goal. Did we not meet our goal? Why didn't we meet it? And they really take a deep dive and look at the why. And with that why, then they can do problem solving. They can do tests of change to make that problem, correct it for the future.
So how are these tools being used in a physician's practice?
Exactly in that way. And in fact, we have an executive team that goes out to our practices in the community and on campus once a week, and we review how the team is doing. We coach up, we help to celebrate successes, and we have an annual event to celebrate those successes with those practices.
Absolutely. So let's just recap here. What can patients do overall just to be more informed and, you know, improve their health?
Oh gosh, do your homework.
Homework is one.
Homework
there we go.
One. So look at all the websites we mentioned. So the government websites, look at our website, look at wherever you're planning on having your health care.
Yes.
Whatever your choice is, before you make your choice, do your homework, research those sites for infection rates, patient care experience, how happy are they with their providers. Ask questions to your friends and family, and then look at the specific hospital website as well. Look for their current trends and what they're doing. When you do go, ask more and more questions is what we really want patients to do.
Nice. You have anything to add to that?
And just be prepared.
Yes.
Be prepared with
Very
a list
important.
of questions, and then ask for resources from
Yeah.
the physician, and
Yeah.
educational resources.
Speaking of that, how can we be a part of the patient safety care program at GBMC?
To be informed about the patient quality and safety program, so that you can visit the website under Quality and Patient Safety. Click on the link, it'll just take you to our website. You can look at the measures and you can look at events that are coming up in the community.
Oh,
And you can
nice.
also ask questions. So there's
Simple.
Yeah, it's
Yeah.
very simple.
Nice. And where can our viewers find more information about GBMC and the wonderful work that you guys are doing?
GBMC.org.
Awesome. Thank you so much, ladies. This was a pleasure.
Thanks for
you.
having us.
Yeah.